Behind the Scenes. I'm your host, Gena Jayne. Thank you for joining us today. Today we have an interesting show. We have been talking a lot about shopping local, the quality of products that we have locally here in our Warner Robins area. And recently I introduced you to the beautiful Gail Slater and her husband, Dr. Slater. Well, with me today is Gail Slater. Thank you for coming
Gena.
back on with me.
I am just delighted to be here. Thank you so much for having me.
Yeah, we did a lot of cosmopolitan talk last time we were on the air. And, you know, in all the conversations we had, we realized that there's even more.
Part of what our concept is in aesthetic and anti-aging medicine is to bring things here that you don't have to leave the town for. Keep our money in Warner Robins and then maybe draw some people from other towns to our city to support us. So we have partnered with an incredible company called Neograft, and it's hair restoration, and it is hair restoration at its finest. 40 million men and about 20 million women are currently suffering with some form of alopecia, hair loss, hair thinning, baldness. For men, it's typically this male pattern baldness, and with women, it sometimes is a hormone issue, which we can take care of and treat. We can identify the cause of the hair loss, and then we do have things besides hair restoration, maybe some platelet-rich plasma treatment. So we have things, get their hormones balanced with Dr. Slater, and then we can see about getting their hair restored to where they feel comfortable and feel pretty again.
Dr. Slater, how did you get involved with Neograft?
2 years ago, I was attending an A4M conference in anti-aging, and I was touring through the vendors, and I ran across Neograft. And I was immediately struck with this product. It has, for most men, I think I'm pretty much like every other guy, who we have some thinning in our hair, we don't like it, it keeps getting worse, we'd love to do something about it, but the thing that always stops us, or at least that stopped me most of the time, was I just could not bring myself to have a big scar on the back of my head. I was really concerned about, you know, what would come in the future, and would people be able to see that, and then everybody would know what I had done. Well, here I am at the conference, and they're showing me a procedure in which there is no scarring. Well, suddenly the whole world of hair transplant kind of opened up. And I went home from that conference and I started studying the technique, and it took me about 2 years to make the decision to go ahead and get involved with Neograft, and I'm super excited about it. I'm very happy we did it.
Whether you're going to ask somebody out, or you're going on an interview, or you know you're with your spouse at an important event, you know that the hair is the first thing that's noticed, be it by the men and the women.
Absolutely.
And you want it makes you feel your best. You can do everything else, but if you don't feel like your hair is at its best, it is very important.
And I
it is
think
our
too,
crowning glory.
For years, it's been hair transplant looks like little doll plugs on your hair, on your head, and it does not look natural. And Neograft, their technicians, the way they do hairline design, it has changed all of that for people.
Gena, why don't you let me have Russ tell you a little bit about the actual procedure itself, because we keep throwing that term around, Neograft, but what exactly is Neograft? And this is the real important part of the whole show here, is what is Neograft and how does it accomplish such great things yet not leave any visible scarring?
The traditional methods of hair restoration involve a very intense surgical procedure, actually taking a scalpel, removing a strip of scalp from the back of the head, then stapling or suturing the scalp back together, with the hopes that we don't have any issues with wound healing or scarring that could stretch or cause even more of a visual issue. So with the Neograft device, what we're able to do is actually utilize an automated handpiece to remove each and every graft individually. And it's very, very important, particularly the automation portion of it, because what that does is it makes every single graft the exact same. So we are consistent and repeatable, the key parts that are important to a good cosmetic procedure. So with Neograft, we harvest each graft individually. We're then able to transplant that to the areas of thinning or balding, typically at the top of the head. So Neograft really represents a true revolution. A couple of things we haven't talked about yet, which I think are really important, is that patients come in many different shapes, sizes, and needs. So our 54-year-old male patient with traditional male pattern baldness, we're going to have a far different approach with that patient than we are, say, the 25 to 35-year-old who's just starting to experience that thinning. One of the beauties of Neograft is because there's such a short recovery time and there's no linear scarring left behind, there's no true wound healing that we have to deal with, Neograft can be customized based on the patient. So when we have a patient who is maybe a younger patient, we know that we're going to anticipate some future hair loss 5, 10, 15 years down the line. So now with the Neograft technology, Dr. Slater can actually create not just a hair transplant procedure, but really a hair loss management plan. And so that may involve a couple of procedures that are spaced out over the next decade to really make sure that someone's maintaining that full head of hair without having to go through a true surgical procedure over and over again. Now, Dr. Slater, I was going to ask you if you could talk a little bit about your experience from a patient standpoint with the Neograft. Share with us what your recovery was like.
The procedure itself was almost completely painless.
Okay.
And I was actually back in the OR the next day doing a liposuction case. And I've really had minimal to, actually I've had no downtime for the entire time, and now I'm 2 weeks out.
Never
and
took a pain pill.
Virtually
Yeah.
it's very difficult
Which
to
is
see
good.
that anything has been done. So it's kind of the classic thing. So I've had a wonderful experience with it, and it just again reinforces to me that we made a good decision about trying to bring this type of technology here to the Warner Robins area. And you don't have to go up to Atlanta. There's only a few places that actually do Neograft right now. Most people, for reasons beyond me, are still doing that old style of strip method. So there's only a few places, and we actually are one of the few places that have it available. So you don't have to travel a long ways to get this kind of up-to-date technology.
And not just the up-to-date technology, but what is the acceptance rate of the transplanted hair?
That's what's really unique about Neograft compared to other options for hair transplant and hair restoration procedures. With the Neograft device, we actually get a 98% viability from the hair that's harvested and transplanted. Guys, this is huge.
That's a game changer.
The traditional numbers with what's referred to as the traditional strip method, where you're left with that huge linear scar on the back of your head, the accepted numbers as far as viability is only around 70%.
Wow.
So when you start thinking about not only going through the surgical process, going through the wound healing, going through the downtime, going through severe limitations on physical activity, to get 70% of what's been removed, it just hasn't been a good option. And that's why we're so proud of Neograft and the results that we're getting, and really being able to work with wonderful surgeons like you. It's fantastic.
And transplanted hair does not fall out.
Correct.
That's the greatest thing, and that's a little known fact, but once you go through that, the hair that you've had transplanted, it's in there for the rest of your life. And that's why we work with, like the younger patients, to ensure what we can do to put them on a long-term plan to keep them with a full head of hair.
Absolutely. And that's the key to it.
Well, this is quite a show, and I have the beautiful Gail Slater
So
with
sweet.
me.
Thank you.
This is quite interesting. You know, when we first talked about the idea of the hair restoration, and of course I knew absolutely nothing. I didn't know it was going to be quite this amazing. And with that said, I would
Yes.
like to turn it back over to our handsome gentleman on the set with us, Dr. Slater and Russ, and leave it with you guys.
Okay. Well, Gena, I know that we've just spent the last segment talking about Neograft, the concept of Neograft, the advantages that Neograft brings, but I know that this show is behind the scenes.
It is.
So I think that it's real important that we go ahead and take a look and see exactly what the Neograft procedure is.
Good afternoon. My name is Michael Oakes. I'm the president and founder of Neograft. And Neograft is unique technology that we just introduced into the marketplace 5 years ago. And the reason it's so unique is because we provide a solution to patients that they've never had available before. Hair restoration is a very important aspect to many people's lives, both men and women. Neograft gives the patients a better solution to the traditional strip method in that they don't have the linear scar. There's no downtime, essentially. They can go back to work the next day. And for patients, especially females, a lot of females change their hairstyles very frequently, Neograft allows them to go very, very short or keep their hair long without having a linear scar. And they don't have the pain, downtime, and wound healing aspect that you have with traditional strip method. Today, Neograft has 3 different aspects of the case which we cover with our device. First of all, Neograft is the only complete harvesting system out there on the market. We actually not only core the individual follicles, but we actually harvest them with vacuum pressure. And this allows the physician to harvest the individual follicles one at a time as they naturally occur without any disruption of the stem cells that reside at the top of the bulb. So the Neograft device, once they're contained into the collection canister, we can then sort those individual grafts one at a time by hair counts, whether it's a single hair count or a 5-hair follicle. We do that without very minimal manipulation of the individual grafts, and we then take it and utilize those grafts with our implantation device. Our implantation device is completely unique. This patented handpiece allows us to actually vacuum up the individual follicle one at a time and then implant them using positive pressure. So there's no hand-over-hand implantation technique. It's simply pulling it up with air and driving it down into the individual recipient site with positive pressure. In today's practices, physicians are looking for ways to leverage their time within their practice, and Neograft actually offers them the ability to provide a state-of-the-art procedure and to leverage the time in their practice. Neograft has partnered with a separate company which provides technicians to come into their practice and assist them with their Neograft cases.
We have here a 1.0 punch, which is right there, and it's a 1.0 millimeter punch, and it's attached to what we call, this is the contra-angle, the motor. The tubing, once the graft has been disattached from the subcu fat, it's going to, there's constant suction going on with this machine. And so once it's released, it's going to go through the hollow punch, through the hollow headpiece of the contra-angle, and get sucked through this tubing and into this chamber, the graft canister. The process of harvesting these grafts involves me looking at the angle of the hair. In most cases, the angle of the hair coming out will give you an idea as to what the angle is underneath the skin. So I'm looking at the angle. Once I think I've got the right angle, I'm going to place the graft on the skin. What I tell our technicians not to do is to first press the pedal and then go dive in kamikaze style, and as soon as that rotating punch hits the skin, it starts to roll away and you've created a scratch mark. Instead, what you need to do is you need to center the hair to the punch, put a little bit of pressure and place it on the skin, and when you're ready and you think you've got the right angle and you've got that hair perfectly centered to the punch, then you're going to simultaneously push down on the punch and press on the pedal. Once again, you're going to push down on the punch with authority. Okay? The graft has been cored, and because there's constant suction, this graft is now a little bit elevated, but it's not released because it's still attached to the subcu fat layer underneath. So the next procedure involved in obtaining this graft is that allow the top 1/4 of the graft to remain in the punch, threaded into the punch, and I'm going to lay the graft on the side, and I'm going to do what's called a drag and pull technique. So again, I'm going to try to drag it out. I may need, there's the graft actually right there after I've dragged it out. So I don't know if the camera can see it, but there's one graft. Okay. I'm going to proceed with the harvesting. I've basically completed harvesting this donor site that we designated to be the donor site, and pretty much. I've skipped around, taking every, say, fourth hair. We've got 332 follicular units. In these units, there's going to be follicular units that contain one hair, two hairs, but he actually had a significant number of 3 hairs, Maurice did. So that's going to help our cause in an effort to try to populate the crown area and provide him with a little bit more density here. So I'm going to make 10 sites, and then I'm going to place them with the implanter to make sure that the depth is correct. When you place a graft, there should always be like 1.5 millimeters of tissue protruding, kind of a cobblestone look, because as we all know, when wounds heal, they contract, and they'll pull that graft in. And what you don't want is these countersunk grafts creating little divots wherever you placed a graft, and then you've got a little divot with the hair coming out. So we avoid that by leaving the graft just about 1.5 millimeters of tissue protruding. That, within the next 7 to 14 days, will dry and slough off, and you're left with a nice smooth surface and hair coming out. There it gets sucked in. I'm going to find me a slit, place it next to the slit, drag it over, or in effect opening it, and place the graft inside.
Baldness kind of happened to our family. My father was bald. I've got 3 older brothers, and 2 of them were bald at a very early age. My wife was not so much concerned with my hair loss as I was. It affected me more than it affected her. We discussed several of the solutions out there, one of them being a hair transplant. And at the time that I was looking at it, there was only the strip method was available. And I don't know if you've seen the strip method, but it is a very barbaric procedure. They literally take a long strip out of the back of your head, and then they sew it back up again, and you're left with a scar. She was not excited about that. I was not excited about having a long scar in the back of my head. When we found out about Neograft through a friend of mine, we researched the procedure, and it just seemed to be much more of a kinder, gentler procedure, if you will. They call it minimally invasive. Now that I've had the procedure done, and it's been about a year ago, I'm glad I did it. I walk around, I catch myself looking in mirrors, and I look younger. Occasionally I'll get a comment when I tell people my age. They can't believe that I'm that old, and it's just a really good feeling to be able to run my fingers through my hair again. The procedure itself was not painful at all. Recovery time was basically, there was none. I went back to work and started doing the things that I do on an everyday basis the very next day. First day that I had the procedure done, I wore a bandage that night. The night after that, I didn't wear one, and everything was basically healed in the donor where they had taken the hair to implant in the front part. Was basically healed. At about 7 days, I had a little bit of scabbing up here, and at 14 days, all the scabs had fallen off. Then after that, it was about 3 months before I noticed that the hairs were actually starting to grow. I call it sprigs. You could feel the sprigs coming back in and growing longer. At about 6 months, it looked very good, and then at about 1 year, it looked absolutely fantastic. Since I've had the procedure done and my hair has grown in, and it's I feel like I've got a large lion mane. I can throw away the baseball caps that I used to wear to kind of cover up the hair loss, and now I can roll down the windows and stick my head out and feel the wind blowing through my hair.
Okay, Russ, that was my exact experience again. I had minimal to no discomfort with that entire procedure.
Absolutely. What's amazing is, and I've sat in on hundreds of Neograft procedures, the patients are very, very comfortable. It's not a procedure to shy away from or be scared that there's a significant amount of discomfort. I have actually, most patients while they're undergoing a procedure are reading a book, playing on an iPad. Everyone's awake and involved with the process. Funny enough, I actually sat in on a case a few months ago with the international CEO of a company who was conducting a conference call in a different language and working on his laptop while having his new grafts placed. It was absolutely amazing. I would like to share with you and the viewers some feedback from another Neograft physician, Dr. Barry DiBernardo, who's got almost
heard of
2
him.
decades of hair transplant experience. And what's nice is he's also a longtime user of Neograft. And so Dr. DiBernardo, much like what your experience was when you came across Neograft, really saw the light bulb turn on when he saw this advancement in hair transplant technology. So we've got a clip ready from Dr. DiBernardo to share with your patients.
Perfect.
Let's go to that now.
Okay.
Perfect.
I'm Barry DiBernardo. I'm a plastic surgeon from Montclair, New Jersey. There's one new technology that we're very excited about, and that's called Neograft, which is going to revolutionize hair transplantation. I've been doing hair transplant for 20 years, but until now, we have not been able to overcome that scar in the back. And now that we can eliminate it with Neograft, patients that were never going to do hair transplant are coming in. They're very excited about this new technique. What it can do that is different from the old techniques, the lack of visible scarring, the faster recovery, the reduction in the post-hair transplant recovery time. I may be a plastic surgeon, a physician, a hair transplant surgeon, but I'm actually a patient also of Neograft. First of all, without having that scar in the back, it's a lot more comfortable. There's less swelling, there's less pain, there's less numbness. The small little dots in the back of your head heal within a few days. You don't have that long scar. You don't have the pain from the scar. You don't have the months of numbness that comes from the big incision. So the recovery time is much faster, much easier, and the quality of the grafts going in are superb to create the frontal hairline. We are always in search of the better and the best and the future technologies. I think in this category of hair restoration, we're there today. The Neograft has brought us to a point where everything has been maximized to the fullest in terms of recovery, in terms of the look of the transplant, the natural contour of the hairline, that we have been waiting for this ideal. It's here now, and I could recommend to those who have been searching and waiting that the time is now, and it's actually a great time to have your hair transplant because we do have this technique now.
Thank you for staying with us. I am your host, Gena Jayne, back with the beautiful Gail Slater. Gail, this is quite interesting. You know, I'm so honored that Neograft's come onto the show with us. I'm honored Neograft is in the area.
Absolutely.
And partnering with you, because that's important. You have partnered with them.
It is huge, and I want to answer probably a question on the viewer's mind is, how do I go and see them? How do I get started with the process? The process is to come in for a free consultation. You can go to the two websites that we've established, neograft@warnerrobins.com or slatermd.com. Give me a call. I'll get you in for a consultation. You'll learn all about what we can do for you. And just know that there's so much that we have to offer that we can bring to each case. Russ?
What's beautiful for the patient about Neograft is that Dr. Slater can actually customize the procedure specific to the patient's needs, but also specific to the patient's budget. So Neograft allows us to do multiple procedures if desired, whether it's because of the age standpoint or whether it's a monetary issue. That can all be completely customized to fit in.
Absolutely.
Dr. Slater, I would like to go back to you and ask, is there anything that you would like to add, anything else that you want our viewers to know?
Well, Gena, first I'd like to again say thank you so much for having us on. It's just been a real pleasure and an honor to be on your show and to have the opportunity to talk about Neograft and some of the other things that we do in our clinic. The only additional point I would like to make about Neograft, you had mentioned it earlier when you said that Neografting is a partnership, and we have partnership with Neograft, and the real value to that is that whenever a patient comes to our clinic and has a Neograft procedure, we bring a minimum of 10 years of hair grafting experience to every patient. We bring modern hairlines, modern techniques, and it's just a fabulous way to stay local and get a real cosmopolitan procedure done, probably at a significant less price than you would in a large city.
Well, I love it. I love that you're offering this here. I love that y'all came out today and joined me with this show for our viewers, because the whole premise for my show is behind the scenes. You know, given that bird's eye view, which we have provided, so people can experience before they actually experience. They can see what it's going to be like, take a little of the stigma and the fear out of it, and see, wow, I can have a new lease on life. And that's exactly what this procedure can give you, is really just a new lease on your life, a new lease on your confidence. So a heartfelt appreciation
Thank you
to
so much
Gail
for
and
having
Dr.
us.
Slater and Russ for
Appreciate
being
it.
with us today on the show. Now, as technology advances and as Dr. Slater gets in new things, we're going to continue to follow. We want to know. He is cutting edge. You know, you're staying on top of the Hollywood trends. That's important. That really is. I am Gena Jayne, your host, and I thank you for staying with us today.